My name is Mike Lovas. I'm the Director of Design and Innovation at Smart Cancer Care. Smart Cancer Care is the innovation program at Princess Margaret Cancer Center here downtown Toronto. And we're taking a really new approach to problem solving to come up with really innovative ways to approach delivering cancer care in the 21st century. So that looks at bringing in digital technology, but also radically rethinking how we deliver care. So do we need to bring patients downtown to sit in our hospital, or can we do things remotely and virtually? And really bringing the patient to the center of the whole equation to deliver cancer care that's really responsive to the patient's needs. And we're not just looking at the patient side, we're looking at all the humans involved. So patients, their family, nurses, doctors, everyone that's involved in the delivery of care and the receiving of care. And I think it's a really exciting time because we're mixing up these new models that we're seeing all over the world that have been helpful and useful in COVID, and now there's like this growing understanding that new models can really help everyone in the delivery of care. I went through having cancer in 2018 and actually receiving treatment here, and that really has opened my eyes to the patient side of healthcare. Previous to that, I was working in healthcare consulting, and so I really saw it from a system perspective, from the provider perspective. But now, having gone through it as a patient, that's really changed the way that I see everything and really amplified the stress and the anxiety and the kind of emotional needs of patients as they go through, and how our system really hasn't been tailored to address those needs. And so now I feel like I went through almost like an auto-ethnographic study of the life of a cancer patient. And so now I'm taking those insights and obviously working with a ton of other patients and patient partners to really drive home a more patient-centered cancer care at Princess Margaret. So I started out in engineering, biomedical engineering, which was a great analytic kind of problem-solving tool set. But then once I went into OCAD, I felt like I was able to have new tools to think outside the box, innovative thinking, blue sky thinking, that has really been a great marriage between my analytic side and my creative side, that in today's hospitals and healthcare setting, I think is critical to be able to understand the evidence, the science, but then also have new ways of approaching problems so that we can really come up with new solutions for the new problems of the day. Yeah, I think the things that really stand out to me about my education at OCAD were, the human-centered design framework, which is, to me, is all about hands-on, making prototypes, making things as soon as you can so that you can get them in the hands of users. So in my case, get them in the hands of patient and family, get them in the hands of clinicians on the front lines, so nurses and physicians, so that you can quickly and rapidly iterate and like slim down that innovation cycle time to days as opposed to months and weeks. In healthcare, there's randomized controlled trials are kind of the gold standard of collecting evidence. We're really pushing the bounds on how you can shrink evidence gathering and generation down to days and weeks as opposed to months and years, and using a rapidly iterative innovation process that leverages a lot of the stuff from human-centered design and lean startup methods. I think it makes a world of difference to be able to drive innovation forward at a faster pace that's more appropriate for today's landscape in the 21st century. I think design is, like, the language of design and design thinking is still relatively new in healthcare, but it's slowly creeping in. And I think it's really a really helpful lens to take, because it's inherently more human-centered than like a technology-driven perspective. And I think that's, I think people are really hungry for that, and it's really well adopted, and people appreciate that direction that we're moving in. Because oftentimes people talk about human-centered or patient-centered care in healthcare, but this gives a set of tools and frameworks so that we're actually able to put the patient and the family at the center of our innovations. So that means bringing them into the conversation, working them into decision making, and helping build prototypes and new models at the outset, and then working with them over and over again to iterate, to shape how a clinical innovation comes to life before it's actually implemented and before it's put into a randomized controlled trial or put out onto the clinic floor. And so that's where I feel like design can really, supercharge clinical or healthcare innovation.